Good morning, good afternoon, good evening. Welcome to the inaugural Global Health Advocacy Incubator Twitter Spaces conversation. Today, we are talking about locally led advocacy, what it means, why it's important, how to do it better. My name is Kate Midden. I'm the Communications Director for the Global Health Advocacy Incubator's Road Safety Program. And I'm joined today by Angela Bruce Rayburn. For the few of you out there who don't know Angela, she is the founding CEO of Diverse Dev, an organization dedicated to combating systemic inequality in the global development sector through diversity, equity, and inclusion consulting. She is also the outgoing, perhaps outgone, though I've yet to come to terms with this, regional director for Africa with GHAI. Angela, welcome.
Good morning, good afternoon, and good evening. Thank you for inviting me.
So, for those of you who aren't familiar, the Global Health Advocacy Incubator, or GHAI as we call it, works with in country partners around the world to build advocacy campaigns around various public health issues. The incubator has programs that range from fighting for food policies that make people healthier to preventing heart disease, preparing for epidemics, and preventing drowning. And of course, near and dear to Angela and I is the road safety program, which prevents deaths and injuries on the road. Uh, Road traffic crashes are the leading cause of death of people ages 5 to 29 worldwide. So, as you can see, it's a range of programs, but these areas are selected based on public health burden, which means how much they impact people's lives in the places that we work. And today we're getting into how we work. I frame this up to contextualize where we're coming from in this conversation. We work all over the world, but Angela and I are based in the DC area. So when we talk about supporting advocates in the countries where we work, there are already many considerations, not least among them being geographically far from the organizations and people that we work with, particularly during COVID. So I want to start with a grounding conversation with a grounding question for today's conversation, which is, what do we mean when we say locally led advocacy?
So, thank you, Kate, for providing that context so that we can have a conversation that is not, just any conversation, but really rooted in understanding what, when we talk about advocacy, what are we really saying in when we are talking about working in other people's countries? But the question about locally led, I think it's a really important one. And I think we need to sort of unpack it in a specific way. Even the way we talk about locally led, using words like, you know, local partners, local advocacy, local, groups that participate in the advocacy process. Why do we refer to them as local? Right, we refer to them as local because we're saying that they're in the particular country that we work in, but even that has a sort of an underlying um sort of explanation, because what we're really saying is they're not in the headquarters, they're not perhaps the same level of expertise that we perceive ourselves as having. So I would like to maybe start thinking about ways that we can shift even when we use these kinds of terms, because what are we saying when we say someone is local? Do we refer to ourselves in America as locals? We don't, right? We're just people who live in the states, or we're just Americans. And so I think with the question about locally led, we could start saying things like, referring to these groups of people as in-country staff and in-country partners, and talk about equitable partnerships, and to sort of elevate their level of expertise for what it is. Because at the end of the day, these are people who are bringing a level of expertise that we do not have, no matter how much we study or how much we know about these countries. Because at the end of the day, these people in their own countries know their context better than us. So I want to just leave that there to sort of say that we really need to start really questioning the terms that we use, and assigning appropriate terminology when we're talking about people in their own country for the ownership aspect of the work that they lead in their own countries that we support through our technical assistance.
Certainly. I mean, this is a conversation that we have often. It's like when you say local, local to whom? When you
Local
say
to, right.
global, global to whom?
Right, right, exactly, exactly, right. And at the incubator, we spend a lot of time on this, right?
Yes.
Because we know that we work in these countries where we go in, and the people there know a ton about the country and about their own context, and also the issue of proximity. You're closer to the issue. You're closer to to the challenges. So you're coming at the challenge with a different perspective than, say, someone like you or me, where we are sitting, in Washington D.C. So just to put that out there as sort of like the backdrop to answer your question, right? So what we mean, our approach is about ensuring that people are have ownership, right? Because we come to this country, we see there are some these are the challenges that we're coming to resolve. But how do we resolve a problem or a challenge if we are coming from outside without grounding ourselves in understanding the context and listening to the voices of the people who are faced with the problems every single day? How do we do that? Do we listen? Do we come with our prefabricated ideas, our prefabricated strategies, our development plans, our metrics, our flashy PowerPoint presentations, and we're speaking to people who sit in this context every day, who have looked at ways for at solutions, who've looked at solutions over the period of time, and say this is the best way to do it. Are we listening to these people? And so when we, and I put this, in sort of quotes, right? Talk about local, what we're referring to is proximate partnerships, people who are proximately close to the issue and to the challenge, and hearing what they have to say about how to resolve some of these issues. And if we do not sort of accept and focus on hearing what these people have to say, we run the risk of creating these programs that we waste a lot of money, we waste a lot of time, we don't understand how to interact with the government, when we're not hearing these voices. So I will end with saying that in country partnerships is the key to doing development work the way we understand it. In country equitable partnerships is the way to advance this work, and ensuring that there is this sense of ownership. People in these countries are a part of the conceptualization. They're part of the design. They're part of the delivery of service. They're part of the implementation. They're part of the M&E. At all stages of the development process, we need to be hearing from people who are proximately close to the issue.
Yes. And I think, in my mind, there are two ways to look at this. One is outward, being aware and looking at the system that you're operating in writ large, looking at the global development system, but also looking at the model through which you are doing this work, the policies of an organization, the way that things are run, the things that you can sort of alter and look at the structure and maybe have some say over. But then there's also the inward part of how you comport yourself as a professional, because it can be in an organizational policy that, you go and you listen and you get information, but it's like, how well are you listening? How are you interacting with people? How much are you taking people's wisdom on board when you are comporting yourself? And this is speaking, particularly from kind of the global organization point of view. And I think that there's a lot that we can get into there. I want to start with talking about the model. At GHAI, I mean, I'll speak for myself that one of the reasons I came to work for GHAI is because everything is built on the premise of people in country know best, and so we are there to support them. We talk about things like capacity building, which we can talk more about. We're looking for an alternative to that term. Some have floated maybe capacity strengthening because every organization we work with definitely has capacity. So that just seems like a holdover term. Um, but it's much bigger than that when we're talking about building advocacy campaigns. So, can you talk about the model in your work, the way that you have operated that you have seen be successful?
I think what you're referring to is those softer kind of skills, right? This
Yes.
idea that, we can operate in development with a lot of bravado, right? You're the big organization, you come with the money, you come with the technical resources, you come with all the trappings, right, of development. And then you come into a country, and so you could comport yourself as such because you that's not, that wouldn't be a surprising thing. But I think that people who are successful in building really strong coalitions in these countries, people who are successful developing uh, high level partnerships in these countries, are people who come to this conversation with a sort of a humility that I think is required in development, right? So for someone like me, I go into a country. So as you know, at the incubator, I worked on Philippines, I worked on China, I worked on Uganda, and I worked briefly on Tanzania. And so I'm going into a country like the Philippines, and I'm not Filipino. I go into a country like China, and I'm not Chinese. And so, how do I build rapport with people to be able to hear what they're talking about, and to sort of remove this idea of being the expert? Because see, I think that's part of the development model that hurts us in the work that we do, right? We elevate ourselves to a level of expertise over people in this part of the world, in many parts of the world. Yeah. And so it's the sense that we're coming from DC with this, with everything. We got all the answers, all the solutions, and we come in here and we're ready to go. And we don't take into account, we're not quiet enough, we're not humble enough to hear what is being said, and sometimes what is not being said, right? Sometimes what you have, when you have to read between the lines, right? And I pride myself on that because I think it's a way to develop strong relationships with people where they can tell you what you need to know and not just tell you what they think you need to hear. And oftentimes you will hear development professionals complain about this. They'll say, well, I was in this country, and, they said one thing, but they literally meant the opposite. And I would posit that you weren't hearing sometimes what people were saying. Sometimes in some cultures where people say one thing, but there's something else that lies beneath. And I think that it's important for development professionals to practice and hone that skill, the ability to be humble while at the same time trying to understand what you don't understand, right? And I think so in a country like the Philippines, for example, where I didn't know the country at all, didn't understand, didn't had never worked there before, but really spent a lot of time getting to know the in-country staff in a way where I could, when they were talking about certain issues, that I understood what they were trying to tell me. And when we would go to government meetings, that when a government official says this, what they're really saying is this, and really being able to get at that. And I think successful people in international development work have must develop that kind of skill.
Certainly. I mean, this is a conversation that we have a lot internally about, how best to approach the work, how to cultivate trust, how to be a good partner, what equitable partnerships look like. And, GHAI, at a time when a lot of global development organizations are looking at different ways to shift their model to be more, should we call it in country led instead of
Hmm.
locally
Hmm.
led?
Hmm.
GHAI is just always trying to iterate in order to, to evolve to meet the needs of our partners. So I want to be really just explicit for the folks who might be tuning in, who might not know as much about GHAI or even the global advocacy space. When we are talking about supporting advocates, we are talking about supporting the development of public health advocacy coalitions who are working to advance policies that save lives. So, Angela, you mentioned the Philippines, and would love for you to just illustrate what that work looks like as a case study in this. Of course, every country has their own context,
Right.
but this is a campaign that you spent 5 years
Right.
working on. Because
Right.
advocacy is a long game. Let's just forget
Yes.
advocacy is a long game.
Yeah, absolutely. Advocacy is a long game. And if you come into advocacy not understanding that and embracing it, you'll be super frustrated. Yeah, 5 years ago, we looked at WHO, sort of best practice about road safety, right? I mean, we talk about road safety in a way that it's easier to hear about HIV, or it's easier to hear about malaria, uh, or those kinds of communicable diseases. But it's different when you talk about something like road safety, because road safety doesn't have the same. It's not. You know that the roads are dangerous in some parts of the world. You know that people die in car crashes and motorcycle crashes all the time, but it doesn't have the same sort of sort of excitement around what you're going to do about developing HIV protocols and those kinds of more, I think, more tangible, I should say, work. So in road safety, you come in where people understand, they get it that seatbelts save lives, but maybe there's no policy in the country mandating that you use a seatbelt, or maybe it's a country where a car seat, a child car seat, what we call a CRS, a child restraint system, um, is not mandatory. And the Philippines was one of those countries. And so 5 years ago, we embarked on this goal to support, well, first to identify and then to support an advocacy coalition of Filipino people who work in this space to to sort of really lobby and champion their government to develop a law around mandating child restraint systems for children under 12 years old. So there's a lot of things around that. If you think about it, people might say, some people might say, well, that's a rich man's, a rich country's issue, right? A car seat. Well, it's not a rich country issue if you understand how many children die in car crashes every year around the world. So that's kind of like the way we had to frame the argument, right? And then so we come into this country, we identify the right advocates through a very long process, right? It didn't happen in 6 months. It took at least the first year in even identifying the right people, the right groups that had the advocacy agenda, the understanding, the will, and even the ones who were interested in developing the political acumen to be able to do it. Okay. So then we are in these countries and we are sort of engaging with them, and we're talking, if they need, we would ask them, some of these groups, like, what do you need? What do you need from us? And it's really important for me to focus on that, because it's not like we went into these countries and we said, you need this or you need that. We went in saying, how can we help you to best advance your agenda? And so we spent 3 years working with these coalitions and the Filipino media and WHO, for example, in country staff, to advance this law uh, of mandating child restraint systems for children under 12 years old riding as passengers in a car. So 5 years, well, 3 years to get the law passed, another year to develop the implementing rules and regulations in conjunction with Filipino people, the coalition, with the media and the government, and then getting to the point where we're now talking about what enforcement and implementation looks like. And that has literally been a 5-year process.
And it needs to be, right? Because in one sense, there is the policy part of it. There is the, looking at a political map and saying, these are the steps that would need to happen for, this to become a law. But then there's also the behavior change part of it, right? I mean, something that you and I talk about a lot in Philippines is that this was not just having a new policy that people would adhere to, but it's really pretending to a fundamental shift in a way of thinking and behaving in a relationship with cars and car seats.
Yes, for sure. And this is where the soft skills that we were talking about a few minutes ago. This is the part where we ask, what are we in these countries to do? And what are we listening to? How are we understanding the culture? In the Philippines, one of the things that was a real issue was uh, when you ride in a car, parents culturally, people put want to kids want to sit on their parents, or the mom in the back seat with the child on her bosom, right? Which is culturally appropriate, and what people do. And now here we are talking about, well, WHO best practice says this, that this is, if you get into a crash, a child that's not restrained, could go through a windshield or whatever the case might be. And to really kind of change that narrative and to talk about what safety really could be and how to make that shift. And I can say to you that it was not easy to do. And we did not do it in the first time the first time we talked about this. We talked about this year in and year out. And having Filipino led organizations with people who understood the context, allowing those people to really be the face of this conversation, to talk about data, to talk about evidence, but to also to talk about culture and to talk about behavior change and what that means, and not sort of overriding what people in the country believed and accepted to be true, right? And so it was an important part of the work, I think, and I saw the evolution, right? I saw the evolution as we engage with Filipino influencers, for example. And one of the influencers that we engaged with was actually in a crash with her child, and her child was in a car seat. And so she was able to be a very vocal advocate to to sort of say, I understand the culture because this is our culture, but I also want you to understand that my child's life was saved because he was in a car seat, right? And so we were able to make that link. But that doesn't just happen. It takes a lot of time and sort of engagement in the media, engagement with the government, engagement with civil society. It's a lot. It's a very complex but necessary process.
What would you say in the case of the Philippines? What were your top two takeaways from that work?
That engaging the right in country staff was probably the most important thing I think we could have done. I We could not have been successful in the Philippines without the in-country staff working for GHAI, because they were both of those ladies were um, um, understood the policy process in a very very they understood it, and so they were able to sort of share the nuance and the pitfalls that we would face in a way that helped us to be more to develop a better plan for how we were going to work in the Philippines. So I would say finding the right in-country staff. The second thing I would say, then, being uh, laser focused on uh, finding partners and being transparent about the partnership, and talking about what equity and what an equitable partnership actually looks like, and making sure that we were being transparent with the groups, because that meant that we were able to build a level of trust with the groups that we you don't always enjoy in some of these countries.
I mean, echoing what you said about having the in-country staff, I think that is something that is illustrative of the successes in the entire program, not just in Philippines. I think you would agree that we work with advocates who these are members of GHAI staff who are nationals of the country in which they work, and they are the ones who are really leading this work and instrumental to its success. It
Uh,
is one thing to spend time, trying to build relationships from headquarters, and you can do that very successfully and very well. But it is just a deeper level of understanding, um, that these staff have that are able to advance the work and make it successful.
Absolutely. Absolutely.
Your second point about transparency and equitable partnerships is really critical, and I want to dig into that a bit. So when you talk about being transparent, what are you talking about? Like, is there an appropriate example that you can give um, about what that looks like? Because there are certainly times, I am sure, where there are people who just kind of want to advance the work, don't really want to get into the politics of it, just kind of want to see change. But I think what you're alluding to is how important it is to just be upfront about the system that you're working in with the people that you're working with if you are going to build that trust.
Right. So the whole conversation around equitable partnerships is a larger conversation in development, right? In our sector right now, we're talking a lot about diversity and we're talking about equity and we're talking about inclusion, but we're also talking about equitable partnerships. And what does that really mean? And for the most part, for many years, we've operated in the development sector as we go into this country and we basically have a budget. We have a partner. The partner don't have a clue what the budget is. We often use people in country as implementers of whatever the project is. We have to develop the metrics for the project in Washington D.C. or London or Montreal or something like this, and then we go to the country and we say, okay, we're here to save you. And we're here to save you with our plan. And here's our plan. And equitable partnerships is this whole kind of conversation that says we need better partnerships. We need more transparency. You can't just come into my country and tell me that, okay, I need you to implement this very small sliver of a very big
Right.
project that has to do with other things and money. And we are just sort of these implementers with no agency, no control, no ownership. And so when I talk about equitable partnerships, I'm talking about us in the development sector, really looking at partnerships and asking difficult questions. How true is this partnership? What is a partnership? Is a partnership where some U.S. Company comes into, I don't know, any country we could use, Uganda, Philippines, anywhere, and they say, we got this project for you and we want to do this thing, and you don't have, you meaning in country people or organizations or civil society have no clue. Is this necessary? Have we vetted it enough? Is the government on board? Are we integrating with the government, or are we just off doing our own thing? Because we have examples from around the world where we could look at and say, what a disaster. Haiti coming to mind,
Yeah.
right? So when I talk about equitable partnerships, and not just me, this is the evolving discussion at the sector level, right? About what that means. And big organizations and small NGOs are starting to question how their equitable partnerships, well, first of all, they're questioning whether or not, even, what is an equitable partnership? Is this even something that we can accept? Because to have an equitable partnership means that you have to relinquish power. And you and I both know that in international development, it's all about the power relationship, right? Between the givers and the takers, right? Meaning the givers being the donors in the way that our model has been developed, right? And the takers meaning the people who are on the receiving end of our largesse is the way I want to put it. Because I want to emphasize the sort of dysfunction and disparity that exists when we have a system like this, right? So equitable, meaning, am I going to give up some of my power? Am I going to give up power in conceptualization of this project? But then again, we have to be honest, because what you're asking is about at the broader level. What if you are in an organization where that is the model, where the model is to be the power broker and to go into the country and tell people this is what we're going to do, because we know organizations like this, right? We know that philanthropy, for example, and the development sector operated on this model for the last 50 or 60 years, right? So we know that. So how truthful are we about that going in? And I'm about disrupting this kind of fake narrative that we have perpetuated in some of these countries. So we need to be looking to identify partnerships that challenge our power in the sector, right? And so I will end with saying, how willing are we to do that? Is that can we be that transparent, right? Um, I don't know, but I feel like it's not something that we can ignore.
Yeah, I could see how someone who's tuning into this conversation and listening to it, and really just someone who works for an organization that is sort of rethinking their model and the way that they comport themselves in this space, could, hear this, think about, okay, yeah, locally led development. Oh my God, what is local? Okay, equitable partnerships. Okay, equitable partnerships. Okay, what's a partnership? What is transparency? What do I mean when I'm doing all of this? And I could see how someone could spiral into existential crisis pretty quickly, but
Mhm,
you really don't have to. And I think, for anyone listening to this conversation who's thinking about these things and maybe a little bit nervous about them, because what we're talking about is a sector wide and fundamental shift in the system. It really is being thoughtful about these questions and revisiting them, because what looks like an equitable partnership right now is probably going to be different than what an equitable partnership looks like in 10 years, in 15 years, in the way that we evolve.
mhm,
So kind of tangential to that, something I've learned a lot from you, Angela, and working with you the past few years, is it when you are in a headquarters based job for a global organization and you are trying to, do well by your in-country partners and really live out this model, it is just as important as supporting the advocates doing, public health policy change or working on a program or, working in some other kind of global development capacity in country, is to be an advocate at headquarters for them, because this is going to sound weedy to some, but I think that this is critical to this conversation, is that anyone in a job is under a lot of competing pressures and dealing with a lot of different dynamics. And often the way that, the in-country led model can be hindered is not because people are doing it intentionally, but because people are just going about their day-to-day work, want to
mhm,
make metrics, to their boss, want to have a good
mhm,
report for the donor, want to make sure that they check something off their list so that they can, get out of the office and go on vacation, whatever. And this is not, I'm talking about broadly that, across the global development sector, that this tends to be the space, but really being intentional about thinking, how are my actions impacting our in-country partners?
mhm,
How does
mhm,
this system or how does this process serve or not, right, in-country partners? And then if you see something, being prepared to really advocate and explain why something is important and how an action aligns with the model. I think there is just a lot of sort of storytelling that needs to happen. And I say that in like the truest, most authentic sense of just like making sure that you're constantly taking a step back and explaining why a certain activity is important, why a certain action is important. I'm being a little bit vague here, but
mhm,
if you have like more concrete wisdom around doing that, I would love to hear it, because I think just being an effective advocate for your in-country partners is just really critical to making this model
mhm.
work.
Right. So I think what you're talking about, y- I think that there's this, I think fundamental to all of this is how development has evolved over the years. When you elevate the expertise of people outside of the country that you're working with, that is a core truth in our sector. Who, when you think about our work, we are in New York, we're in DC, we're in London, we're in these countries. We're in, so-called developed countries, right? And then we're in the, and oftentimes we're in the headquarters. And as you say, we have to do many things. There's lots of competing priorities. But I think if you don't focus on what what is what is the core of what we're doing, where does the core of what we're doing lie? It lies in the countries in which we're talking about, right, where we work. And so I think we have to shift our own thinking about where the expertise is. And that is a big thing in international development,
Yeah.
right? It's a huge thing. And we're not, and I will say that we're not willing to do it easily. It's not like happening very quickly. But as an example, I worked in Haiti before I came to the incubator. And as the person who worked, I worked on Haiti in DC. And one of the things I learned was how to tell the story of what was happening in the country. And this is after that first earthquake in 2010, but how to tell the stories of what people are saying in the country to people in DC, and how to translate it. And I use the word translate not accidentally. I use the word translate because so many times in international development, we have no clue what's going on in these countries. We don't have a clue. We don't have the time to understand it. And unless there are people working in the organization to kind of focus on it and make sure that it's a part of the broader discussions, you'll struggle. Because oftentimes, as you say, we have to get that donor report out. We got to get that nice PowerPoint going. We got to get that metric, that great table with all the arrows and the colors and the things that show that we are doing the job. But I wrote somewhere, sometime that where else but the development sector can you find this system of countries where the people are, there's developed countries, people are mostly white, mostly wealthy countries where they can sort of where they can sort of conceptualize and develop parameters for Black and Brown people around the world, where they can devise the the service delivery model, where they can devise the M&E model, and where all of these things are coming from outside, and then they come and they plop it down into a country. Where else but in international development can you find this kind of level of sort of tone deafness that occurs in the sector, right? So I said all that to say that sitting as a person in Washington, D.C., and trying to tell the story of what was going on in a place like Haiti in a post earthquake environment, and then translating it so that people in D.C., when they had ideas about what they wanted to do, right? When they had ideas about what they wanted to do, but they wanted to run to the country and do these things, and then they needed to be people like me in DC to say, well, wait a minute, I don't think that this is the best use of our resources. Or I think we need to talk with the in-country partners a little bit more to understand whether or not your idea of what you think needs to be done should be done, and really trying to be that person. And I think that if there's nothing else that I've learned in the last 5 years at the incubator, is that I spend a lot of time trying to be that voice for my in-country people, because I know that they know more and they understand the context better than me, and I need to always ensure that their voice is a part of any conversation that we're having in DC.
It is excellent wisdom. And I think, particularly for even young people who are getting into the global space, I think there can be a sense of, oh, this is just the way that things go here. And it's like, no, if you see something that is not going the right way, I mean, often it is a matter of advocating, of telling the story, of kind of having the facts right about how things need to go. And that all starts with listening to the in-country people that you work with.
Right.
The
Right.
Very quickly, I want to go ahead and remind everyone that if you would like to join this conversation, please do tweet us your questions. Just use hashtag GHAI chat. We are monitoring those and we'll try to get to them. The Let's see. We've covered a lot. We've covered a lot in this conversation, but I feel like there are so many places yet to go. Um, when you think about the past 5 years of advocacy that you've had with GHAI, and then your long background of advocacy and policy work before then. I know that we have talked about takeaways, we've talked about the importance of listening, we've talked about equitable partnerships. Are there other elements that you would urge people to think about as we look at kind of changing this model and this system to be more in-country led?
Now that's an interesting question, because here's the the fact about the matter is that we have to go back to what is the purpose of philanthropy, or what is the purpose of this work of development. What are we trying to do? Because if you think about it, in the words of a woman I met at this organization, in the African Visionary Fund, she said to me, we were talking about what is philanthropy, because there are people who say, well, it's their money, and these are the donors, and it's their money, and they should be able to to tell you how to spend it, right? Because it's their money. And she says, well, it depends on what you think the purpose of philanthropy is. Because philanthropy, if the goal is to move money, then or is the goal to move money, or is the goal for you to be in a country far away and oversee the money that you're moving? What is the goal? And so I think that, yeah, we're in a time now where a lot of these questions are being asked in international development, and in philanthropy, right? These questions about equity has really changed what we used to think about as normal, right? Because now that we are really digging into equity and equitable partnerships and issues around equity, now we're saying, well, maybe we have to, maybe there's a problem in the way we've done this in the past that has created a very imbalanced system of haves and have-nots, and givers and receivers. And maybe that imbalance has not served our purposes at all, right? So maybe it's time to change. Now, I don't know that we are really going to do it. People ask me all the time when I give these kinds of talks whether or not I think that this is a watershed moment in our sector. That all these conversations around equity and inclusion and all that how they have permeated our sector, and how it has forced us to challenge ourselves in a way that we have not done in the past. Yes, that has happened, but I don't yet know, and I don't yet have a sense of, is it going to last?
Mm.
Or are we going to go back to business as usual when we get too uncomfortable talking about equity, when we start challenging powerful interests about equity and imbalances and the power relationships? Because when we get to the point where we're challenging people and having them understand that they have to give up and or share power, that's when we're going to know if this is for the long haul. I don't know yet, and I don't have a sense of what that means yet. So I go with the optimism of recognizing that we're in a movement globally where we're focusing on equity, and that spillover has sort of been, sort of like a galvanizing factor for us in the sector. And that's where I want to leave it, because I don't know where we go, when powerful interests reject this idea of, what equity is, and why we need it.
And that does seem like a good place to leave it there. Optimism, but much more advocacy to be done all the time. Angela, thank you so much for joining us. Anyone who is joining the conversation today, please do take a second to follow us at Incubator GHAI. We plan to have many more of these conversations looking ahead into the future. And if you have feedback, questions, anything, please do feel free to tweet Angela and I. As we mentioned earlier on, we at the incubator, we're always looking to iterate the model that we have to be more in line to better serve our partners. We're looking for alternatives to certain terms that we use, language that we use, If you have ideas about things like capacity building or other terms that we use or alternatives that would be suitable or that you think are appropriate, we would love to hear that kind of feedback. We are very, very open to it and always searching for that. So I will leave us there. Thank you. Check back, and we'll leave everyone to your day.
Have a great day. Thank you, Kate, for inviting me.
Of course.
Bye.
Thank you for doing it, Angela. Bye.
Bye.